Hello everyone, and welcome to today's webinar, AI Built for Oral Health Access, exploring the impact of artificial intelligence and augmented intelligence on dentistry and oral health access. So again, my name is Danae Pignon, Program Coordinator for NOAA and today's moderator. So before we start, let's review a couple housekeeping items. This webinar will be 60 minutes long with one CDE available. It will be recorded for future viewing on our online learning platform, Dialogue EDU. You could submit your questions in the QA box anytime during the presentation. We have scheduled time following the presentation to answer your questions. Zoom will email all attendees a survey within 24 hours so you can provide feedback and request continuing dental education credits. The deadline for receipt for those surveys will close on Business Day Monday, August 19th. Please note that NOAA does not issue CDEs for group attendance. To qualify for CDE, you must be registered and logged into your own Zoom account registration link. To receive CDE, all attendees must be on for 75% of the webinar, which equates to 45 minutes. Attendees that do not stay online for that amount will not receive CDE. After completing the Zoom survey, within 10 business days, you will receive a separate email to access your CDE certificate. Remember, you must complete the survey by August 19th in order to receive the CDE, and we cannot issue without survey completion. So let me introduce today's speakers, Dr. Terry Dolan and Dr. Mina Garboni, and now I will turn our presentation over to them. Thank you.
Thank you so much, Danae, and it's a pleasure to be with you. Let me begin by thanking NOAA for this opportunity to share some of our knowledge and work with the audience. And I thank everyone in the audience for taking time from your busy schedules to join us today. As a brief introduction, Mina, we can go to the next slide. Just a little bit about myself, and then I'll ask my colleague, Dr. Gorbani, to also share some background. I serve currently as the Chief Clinical Officer for a dental AI company called Overjet. Before joining the company, I was Professor and Dean at the University of Florida College of Dentistry for many years, and also a diplomate and past president of the American Board of Dental Public Health. And so I have dental public health, as part of my fabric. And that's why I'm really excited to share this topic with this particular audience. I also currently serve as president of the American College of Dentists and past president of the Santa Fe Group. And it's a pleasure to work every day with Dr. Mina Gorbani. And Mina, if you would tell everyone a little bit about yourself.
Thank you kindly so much, Dr. Dolan. It's an honor to be able to work with such an amazing industry leader such as Dr. Dolan here, and I'm so honored to be able to speak with you all today. I'm a senior clinical manager at Overjet, Dr. Mina Gorbani, and here to tell you guys all about AI. I'm a graduate of the University of Florida College of Dentistry. I had 5 years of kind of practical experience working at Apple in technology and implementation and translation of that information to people. And I love doing that. So that's how I ended up here. Along that, I work most closely with academics and special markets. And that's the main crux of what I do, alongside working with the machine learning scientists to help develop the most practical and clinically relevant models that we can provide here at Overjet, as well as being an ADIA corporate council member and engaging with our partners at the dental schools. So it's a pleasure.
Thank you, Mina. And if we can go to the next slide, of course, we want to disclose that both Dr. Gorbani and myself are full-time employees of Overjet. And if we can go to the next slide. But we've organized this session in a way that we hope is educational and public health focused for all of you in the audience. You've seen our learning objectives already. Just to briefly restate them, we will review briefly core concepts in dental AI and then focus on how they relate to dental public health. We'll emphasize the point that the computer vision platform that we'll be describing that does assist clinicians in identifying common clinical findings is really considered an assistive technology, and will emphasize the difference between AI, machine learning, and these various assistive technologies that are available to each of you to support you in your work in dental public health. We'll talk a little bit about AI's role in dentistry and oral health in general, with an emphasis on early detection of disease, personalized treatment plans, and hopefully efficiency in healthcare delivery. And then we'll spend a little time about future trends in AI. But before we get started, maybe you could help us by giving a quick sense of where you are on this AI journey, and ask, how familiar are you with AI applications in dentistry? If you could just complete this quick poll, are you very familiar, familiar, unfamiliar, or very unfamiliar? And we appreciate you taking a minute to respond to that poll. And it is interesting, while AI has been around in dentistry actually for many, many years, and we'll talk about that, the applications that we'll be speaking about as an assistive technology are relatively new. So thank you for completing the poll. And it looks like we have a mix, which is what we would expect. Some that are very familiar. And so we'll invite you to answer questions, and either throughout the presentation, or we'll respond to a Q&A at the end. Or those who are unfamiliar, here's your opportunity to have an introductory lecture. And Dr. Gorbani and I actually will both be at the NOAA conference as well, and looking forward to interacting perhaps with you at that session in September. All right, so Mina, if we could go to the next slide. I'm sure many of you are familiar with the first ever Surgeon General's report on oral health, which of course was published in 2020. And as public health dentists, we refer to this document a lot. And you know that in 2021, the National Institutes for Dental and Craniofacial Research published an updated version called Oral Health in America. And if you compare the two, there's of course many similarities about disparities and health inequities that still challenge individuals and populations in our country. But what's different perhaps from the first version in 2000 to what we see in 2021 was this new section called Section 6, which did a really nice job summarizing emerging science and promising technologies with the hopes and the intention to transform and improve oral health care. And so I would refer you to that just as a nice reference. And it really highlights that with the information age and the availability of data science, it really facilitates the use of these technologies to help us more accurately and consistently diagnose common clinical findings, and then use those findings to do more effective treatment planning. And we hope ultimately, of course, this will lead to improvements in evidence-based care and improved quality of care that we deliver for our patients, independent of the setting. But of course, today's discussion is focused on public health settings. I mentioned already that dental AI has been around for many years, and here's just a few examples of how AI has been used in dentistry. And if we think about CAD/CAM technology, for example, which has been around for more than 30 years, much of that under the hood, maybe not as obvious when you think about how the CAD/CAM technology and digital scanning and crown design and milling works, but actually a lot of that has AI and machine learning built into the technology. Just as with CBCTs and segmentation of anatomy and ability, say, to identify pathology related to endodontic lesions, or even assessing airway, all of that segmentation and assistance in interpretation can all be facilitated by AI. Other examples on here: smile design, orthodontic alignment treatment, maybe more recently, voice-activated periodontal charting, and then a lot of the systems that underpin patient management and scheduling. A lot of those are even more powerful today because they use AI as part of how they work and how they facilitate your work. So, Dennis, this is not new. AI is not a new concept. But as computing power improves and is more available, It has been more relatively recently applied to do 2D dental radiography. And I'll also mention that even though we work for Overjet, there are many companies out in the marketplace that are really bringing exciting new innovations to dentistry and to clinical practice. And so I think it's great that you're listening in and learning about computer vision and that particular platform. But I think it's a really exciting time to be in dentistry, where we're going to see more and more technologies to assist clinicians and team members in their day-to-day work. You might be asking, well, are there any standards that underpin these new technologies? And I do want to point out, as another important reference, that the American Dental Association, which does manage standards for materials, for example, also is writing or has written this standards document as an introductory standards document related to AI. And so this is the first of probably many to come publications on artificial and augmented intelligence. And I'll just point out that the ADA is very specific about the difference between artificial and augmented intelligence, and really highlights the fact that these tools are not meant as a replacement for dental professionals, but rather as tools to enhance their skills and ability of the clinician and the clinical team members. And so we agree with that assessment, and we like the term augmented intelligence as a subsection of the AI machine learning that's developed really to enhance clinical intelligence rather than operate independently or replace it. And I know that, as we're learning about AI and how it can be applied in clinical practice, that's a question we commonly hear. Is this going to put me out of the job? Why would I adopt a technology where my knowledge and skills are no longer necessary? And we always include this slide in our presentations to reassure you that these are really clinical decision support tools to really enhance your capability, improve your efficiency, your consistency, your precision, and not to replace you or the clinical team, because you're always essential in that care delivery process. And so we'd just like to start out front before we go into a little more detail clinically about what AI can and can't do. There's many things that AI can do to help us in clinical practice. It can help detect suspected pathology on dental radiographs. It can help clinicians improve their diagnostic confidence. It can improve diagnostic accuracy. There's actually some growing evidence that it helps in patient communication and helps enable individuals to understand their clinical conditions, and that then results in improved case acceptance. And if we think about it from an epidemiologic perspective, big data also helps us understand clinical trends and maybe helps us plan interventions more effectively for populations. But there are some important things that AI cannot do. One, we've already mentioned, it doesn't replace the clinician. It doesn't perform a clinical exam for you. That's something that you still need to be a skilled clinician, a good observer, someone who routinely does a comprehensive oral assessment. It doesn't diagnose for you or treatment plan for you or replace the need for good quality x-rays. But it can really help you, especially in today's world where we're busy, we have so many patients to see. And it really helps us in terms of the quality and efficiency of the care we provide to our patients. And so I'll end my section on this note because I know each of us comes to work every day with the intention of doing the best we can, whether we're bringing the best products to market in a dental AI company, or you're managing an FQHC or community health center, or you're directly providing care to your patients. We're all going to work with the intention of providing high quality care, and also always noting that we know that there are tremendous oral health disparities among populations. And so I just want to highlight that AI technology, what we'll talk about is that's available today, is probably just the beginning of what I see as greater opportunities moving forward to really address issues of health inequity and disparities. And so we hope that over time, as we build better tools and and incorporate, in addition to radiographic clinical findings, for example, add salivary biomarkers or integrate that with clinical and socioeconomic data, and use a multimodal assessment that will enable us to provide more precise, accurate, customized interventions for either people or populations. We think this AI technology at an aggregate level can help us understand disease trends in populations and prevent them either at the individual or population level. And we also know that we're going to see more and more products coming to market that really help us administer the process of care delivery more efficiently. In addition to clinical decision support, maybe help us do our paperwork, document clinical findings and record notes, et cetera. So I think this was a really nice article by our colleagues at the Harvard School of Dental Medicine, and I would add that as a third reference for you interested in this topic and how it can potentially address issues in oral health disparities. So that was kind of a high-level overview, and now I'm going to invite my colleague, Dr. Gorbani, to let's take us to the clinical level and see how this technology can help you in your day-to-day practice. Mina?
Fantastic. Thank you so much, Dr. Dolan, for that beautiful overview of what AI can do for dentistry and what it is doing. So with that, I'm actually going to take you back a couple years. Let's review the radiograph. Take some time if you want, take a screenshot or take a photo, like a photo with your phone, whatever you may have you, and try to do a little bit of radiographic review. And with that being said, take a look and see if you can evaluate what if there are existing restorations, indications for radiographic bone loss, calculus, caries, things to that effect. And how easy is it for you? Once again, we're not in a perfectly placed room where we have the highest resolution screen necessarily or the right amount of light to review radiographs, but that's the case for general dental practice. So we won't always have the most ideal conditions, but wouldn't it be great to be supported and assisted and augmented so that way we can get closest to those ideal conditions? With that, I'm going to go ahead and continue. All right. So you want to ponder while you're listening. That's great. So we know dentistry today is very fast paced. There's a lot of time pressure impacting our diagnoses. And diagnosis in general seems to be unstandardized. We've heard the age-old story of, well, one dentist said this and the other dentist said that. Dr. Dolan brought to my attention an article from the Reader's Digest, and I was a child when that came out, about how there were 50 different diagnosis and treatment plans for this one reporter that took their FMX to multiple dentists. The existence of Overjet is from the fact that there was an engineer or CEO. She went to one dentist after having been treated by her local family dentist, got a different diagnosis, was not satisfied, and seeked a second opinion and noticed that there was unstandardized diagnoses. So this is still happening in our industry, and we want to make sure that we can get to a place where we're more calibrated against what we see in between an inter-reader review of radiographs. And then ultimately that will lead to better case acceptance and trust. So we'll follow these 3 points as we continue. So there was a study, this publication from 2019 that came out that was pointing out when faced with time pressure, clinicians' diagnosis is impacted with less radiographic caries by 40% and less periodontal disease by 67%. This means that there's a higher chance of negligence or potential negligence if that's how the patient feels, but we need to give our patients the care that they need and give the time that they need to review the radiographs that we're taking of them. So what better way to do that, or to reduce the cognitive fatigue that we may have upon having all of the tasks and all of the hats that we have to wear as a dentist in clinical practice. So now let's go and take a closer look at those radiographs that we showed a couple slides ago. And I want you to take a look at the bite wings on the left-hand side. And this is a closer zoom in, so now you have more ideal conditions to be able to review them. But how long does it take you? How quickly can you do it? What amount of time do you need? And how accurate do you think you are? So with that, I'll lead to the very next version of this image. If it wants to animate for me. There you go. So now we're looking at an augmented image, an image that has AI predictions on it. This was not annotated by another human. This image was fed through a machine learning pipeline, and it's been overlaid with predictions for bone level measurements, and various millimeters are highlighted for you, as well as areas of potential caries, whether it be in dentin or enamel, as well as calculus. And the calculus is identified in different boxes. Now, consider how quickly and how much easier it is to review the images from the left to the right. And necessarily, would you agree to the exact prediction or the size or any of that? But the first thing is, unlike ever before, we're able to quantify between the readers the size of these lesions, right? We actually can measure in pixels how large that lesion is relative to the size of the anatomical crown present in the radiograph. Quite amazing. Also counting and identifying all of the calculus within the image, making sure that our hygienist is being very thorough and scaling appropriately, as well as being able to monitor the progress of the bone levels and or the size of these lesions that are present. It's quite amazing in the way that it's able to augment the user in ways that we've never been able to do before. I don't know about you, but I don't know if I've ever actually calibrated the measuring stick and measured every interproximal bone level. I might have measured the most severe one. But this is a way to monitor as many of these sites as possible. So let's continue. So with that, we're looking at how AI is going to go ahead and improve the entire workflow. We talked about how it's going to reduce disparities, and this is coming from the idea that the workflow is going to be augmented as well. So being able to identify, outline, and quantify the measurements of oral diseases. Then imagine aggregating this information, highlighting all of the care needs that are present within your population that you're treating at your clinic. And then finally, making sure if you're being part of a network where you're using a payer, that the claims that are being submitted result in a faster payout. So that way, those who are giving care are being compensated accordingly for the care that they've given. So with that, we're looking at addressing these disparities by going into the needs of the patient, highlighting those needs, making sure that they're visible for detection for the provider, and making sure that it's very accurate in diagnoses. These models are considered medical devices, and they go through rigorous testing to make sure that they are going to be clinically relevant in patient care. So with that, you're looking, especially, you want to make sure that the models or the product that you're choosing is something that's cleared by the FDA to be able to provide that finding. So making sure that that's part of this conversation. And then once you have identification, detection, and diagnosis, then now you can go into the actionable insights and making sure that you're uncovering the needs that the patient has, and then accurately going into a treatment plan to making sure that the patient is going to receive that care. And then hopefully is that we're leading towards operational efficiency. So when we take that historical data, no patient need is going unmet because you've identified all of them. They're documented. They're within the notes. You've had that conversation with the patient. And now we're streamlining it back towards whether that be the insurance claim or making sure that there's the proper identifications in the ledger and moving all things forward. So it's really about equipping the office, the team, the providers with the tools that they haven't had before. So as we continue, we're looking for operational efficiency here and showing the care needs that are potentially within the practice, because humans are inherently, whether we want to believe it or not, we have a little bit of bias. We might not necessarily be the most thorough every single day. We might be sick one day. We might have other things that happen to us that reduce our cognitive ability to be the highest performer we always like to be, and we really achieve to be. But now we have a way for AI to come and help identify all of these care needs that might have gone misidentified, underdiagnosed, and to be able to review those cases. So say you have a slower day, maybe you're having an admin day, and going through and doing a quality assurance of all of the different predictions that the AI is identifying and identifying as unmet needs, right? So you can have these centralized dashboards. And I don't know if we have anyone on the webinar that does more administrative tasks and tries to aggregate reports and look at data across the practice or the clinic. This is automated now, right? If it's an automated report, it makes things just a little bit easier and simpler to review. So whether that be the caries needs and there's a larger carious lesion, or there could be potential recurrent decay, or if you're really focusing on making sure that the incipient lesions are receiving the ADA guidelines in terms of conservative care and non-surgical care, making sure that that program that you're trying to implement is really being highlighted, or whether you're really looking at this underdiagnosed periodontal disease that I identified a couple slides ago and making sure that those cases are being reviewed. Maybe you need to call the patient back for a further exam, and that's all possible now. Or you've taken radiographs and they haven't been billed, but we've identified that. So it's kind of amazing in that fashion. So with that, we're looking to then close this loop, right? We bring back the payers into this conversation because they exist, right? Insurance companies exist. Some patients are insurance dependent. They want to know that the care that they can receive care under what their payer is going to pay, as well as someone who is going to be part of that network. You want to make sure that you're getting paid for the work that you're doing. So why not streamline the claim submission and understand a little bit more closely and with transparency what they're seeing? So with these segmented and outlined pieces of information, whether it be the restorations that are on the existing restorations on the teeth, whether we're looking at bone level measurements for a patient that has periodontal disease and is staged and grade, and you're recommending to have a SRP done, why not give that annotation as part of a fortification to the insurance claim? Submit the raw radiograph, but also have an annotation to give you that quantification that wasn't possible before. So where does this apply to the workflow, right? So AI we've identified as this incredible technology. Digital dentistry has a workflow. All of these new technologies will have new AI incorporated into it. Think much like how plastics have incorporated into our life, whereas it might have not been possible 100 years ago. Now we have the same thing happening with AI. So if you think about your daily workflow that you have in the clinic and then within the practice, we look at chart preps. Hopefully you're doing chart preps. Hopefully your team is doing chart preps. You're reviewing and preparing for the day that's to come, and then having a discussion and having a morning huddle, identifying the most important key and needs that are going to happen in the day. Then you're doing real-time findings with the patient, doing real-time findings and reviewing and doing a radiographic interpretation prior to doing the case presentation for the patient, and improving that patient communication conversation so that it's even more colorful, if I may. So with that, let's go into the very first segment here, and we're looking at how AI can support the chart prep. So you're walking in for the very start of the day, and whether you're, depending on your role that you have within the clinic, we've identified ways that the AI can support doing the chart prep more effectively, more efficiently, and make it a little bit more of a smoother process in the morning. So making sure that the clinical findings are reviewed quickly, like I showed you, bam, bam, bam. How much easier was it to review with the AI findings? Just drawing your eyes to the areas of concern, evaluating those needs. And then as a hygienist, identifying what are the things that need to get done during that appointment for the recall. So whether that be updating radiographs, updating the perichart, imagine if that was automated and you in just opening up a platform, having to being able to identify it, versus in current practice management systems where it's kind of deep within a set of clicks that you have to do into the patient chart. And then once you've identified certain cases and certain needs, maybe having that conversation with the patient and preparing them for what they might hear from their provider. And then the assistant can also highlight and flag certain things if the doctor needs to know about treatment that's coming in for the day. So the assistant also has this capability now to identify and be supportive in radiographic review and say, oh, well, the AI has identified a couple things. Doctor, do you want to review these? And then from an administrative standpoint, making sure that we're coding appropriately, making sure that all the operations that are within the practice are going smoothly. If there's a need to review miscodings, non-codings, and things like that, closing those loops up. So as we continue, I've actually gone through that one. And this is what it looks like if you're thinking about what kind of prediction you may or may not see. So the AI can identify potential carious lesions. It will be able to tell you if it's a two-surface lesion, because based off of the location of that prediction, it knows if it's on the mesial or the distal of the tooth, and thusly can prompt a slightly more actionable review of what needs to be given to that patient. Following that, if we have miscoded perio-maintenance, we know that someone who's been diagnosed with periodontal disease has gone through scaling and root planings, thusly needs to have a perio-maintenance to maintain their periodontal health. So identifying that, because we know the treatment history of the patient, we'll be able to help support something like this as well with AI. And then as we continue, so wouldn't it be great to be able to turn the findings on and turn the findings off, review, get prepared mentally for what's going to be in the chair? How do you want to have this conversation? How many enamel lesions are there? How many dentin lesions are there? Which ones do I need to check for cavitation? All of these different conversations are going to be built into a queue so that you're prepared to have this conversation, either with the patient or in a group setting, whether you're with a minor as well. So then we move on to this morning huddle conversation. And there's, yet again, for each role within the clinic and the practice, you can identify places where the AI is going to be able to support. So whether it be the follow-ups that need to be taken care of, yes, we're only segmented here. So any of the follow-ups that need to be taken care of and identifying that, if the hygienist has identified a review for a possible scaling and root planing and a diagnosis of periodontal disease. So maybe we need to start looking into the pre-authorization for that. See how it's enabling all of these newer workflows and more efficient and effective workflows. And then maybe there's something undiagnosed that the AI has identified and needs to be reviewed and treatment planned. Similarly, the assistant, maybe there's an identification for treatment that needs to be addressed during an appointment that the patient's coming in for, and make sure that the doctor reviews anything else. Say that you take a working radiograph during an endo and you see on the adjacent tooth there's something else that you weren't really paying attention to because the only thing you were focused on was the endo. So it's a very different experience now. And then the front desk, as always, looking at the operations, making sure things are running smoothly, correcting the miscoded perio maintenances, going back and making sure that any radiographs that weren't billed are being billed, or updating and reminding people to take radiographs, or updating charts, and properly preparing the financial agreements here. So, and then as we continue here, we're looking at real-time findings. And I find this to be the most impactful as a fellow clinician here, because I know it gets really busy and it gets difficult sometimes to be disrupted during a procedure, to go do a recall exam and then refocus. So having a little bit of support in drawing my eyes to the areas of concern. And I've noticed that I'm also astute to when the AI has not captured something. I have a little bit more space to even see any of those. And it's ensuring that the radiographs are all being reviewed, right? Because you get all of these notifications that are bringing your attention to the areas that need the most care. And you're then, once you're able to detect, if you think about the next step after detection is being able to diagnose, right? Is it active or inactive disease? And then as you have the hygienists on your team, making sure that Overjet or any of these AI platforms are something that can be pulled up, reviewed, and supporting the patient's conversation while we're bringing the doctor in, and then it helps guide the doctor through the exam and making sure, especially since the hygienists are so great at monitoring the periodontal status of the patient, really being able to identify and build and empower that collaboration on making sure that the bone levels don't increase, right? We want to maintain the bone that we do have around the teeth as we're going through treatment. And then the assistants are always being effective and efficient in pulling up these findings, and that the radiographs are being able to be evaluated and going through a very strong exam, right? And maybe even calling out like, oh, there's a finding that we want to review here, doctor. It's really, really supportive. It's a great support throughout the workflow. And if we're looking at the workflow more clearly and not just something that you have that happens on your day-to-day, you seat the patient, you go over chief complaints, you document all vitals. Hopefully you're updating any of the periodontal charting that needs to be updated, and if it's indicated to do so. And then any other additional data that you want to document, whether that be intraoral photos, scans, radiographs, and go from there. And then once the recall, once you have all of the data that you're looking for and typically acquired during the beginning of the exam, you are now able, you typically review the radiographs and speak to the patient on what the new findings are. And then they go into the prophy or the perio maintenance and follow up with OHI, right? But what happens is when you add in an AI tool, you get to use that part of the review and the exam. And if there's any conversation that needs to happen or any information that needs to be further explained to the patient, that's where this would happen, right? During that exam and in real time, being able to show the patient what's going on. And we'll get into that in my next slides. So these are the areas where it changes. So you're able to do your radiographic interpretation utilizing an AI tool, and then subsequently using that to further explain the diagnosis and the treatment plan to hopefully lead to better case acceptance here.
So Mina, there was a question. I'll just interrupt for one second.
Sorry, yes, please.
And we get asked this fairly often about concern about potential overdiagnosis of dental caries, for example. And maybe if you would go back to that workflow for a second. I think it's really interesting that, you know, it is the dentist's responsibility still to collect all data, you know, visual assessment, understanding behaviors and risks that patients may have related to caries risk, for example, and incorporate that into a diagnosis and treatment planning. But maybe if you want to comment on that as well. The question is, how do we ensure that the tool doesn't promote overdiagnosis or overtreatment?
So I actually might go a little bit further back because I want to pull up. Oh no, we don't have it here. So there's depending on how closely you've ever reviewed the ADA guidelines for the different care modalities, whether it be surgical and non-surgical, right? If you have an initial carious lesion identified, there are guidelines for this treatment, and not identified in the specific screenshot here, but if the AI is identifying an area of demineralization that would be potentially decay within enamel, instead of saying interproximal caries to surface restoration, it would say interproximal caries or initial caries and say preventive treatment, right? The goal is to incite evidence-based care and the best kind of care to get the best outcomes for the patient. Now, can I tell everyone exactly how to treat every single patient? I cannot, nor can this tool, because that's not what it's designed to do. It's here to help detect disease, so that way the provider is the one who's going to make the final decision on what the diagnosis and the treatment needs to be for the patient. And ultimately, that diagnostic responsibility always lies in the hands of the provider, because diagnosis is a multidisciplinary case, and you need to have the clinical exam as part of it to make that final decision. So
great. Thank you, Mina.
Welcome. Off we go. So I will leave this here for a moment just so that you can see how the platform brings in to color the findings, right? So much like any of your image viewers that you've seen before, you're able to toggle on and off the findings so that you can still do a unassisted radiographic review, but you can turn the predictions back on There's measurements, there's quantification, there's percentage of impact to the anatomical crown visible on the radiograph itself. It is limited to the fact that it is a 2D radiograph and does not do magic and review in a 3D sense or any volumetric measurements. But it does allow for this individual review of these different predictions and itemizes all of them so that the exam is very focused and identified in the way that you can review and even dictate to input this information back into the patient's chart. And there's an ability to also export these images with the predictions, without the predictions, for patient education, for insurance claims support, as such. So with that, we get into my favorite part, which is patient communication. And when I have a patient in the chair, I have a radiograph, I won't lie, I used to sit there with a marker, and my assistant would absolutely detest me because I would color the screen in and say, well, this is the distance of the pulp, this is the area of decay and demineralization, this is what we need to take care of, and this is why. Now with a tool like this, it's automatic. It just shows up, it's in real time. So showing these relevant AI findings, the hygienist is also able and capable of pulling up and leaving it up, not diagnosis, and not even detection, but saying we have a tool that supports our doctors and there's identification of areas of concern. Let's get the patient prepared for the fact that they have needs that need to be met. And similar, the assistant can do as well. And then the front desk can fortify that, or the treatment coordinator can fortify the conversations that these are the areas that we've identified. Would you like me to review them with you? Would you like the doctor to continue this conversation? So that way it's most complete in that circle of care, and it's most customized as possible, and we're as precise as possible. So when you're going into patient communication, look at this difference, right? The story on the left is what we're used to. Black, white, and gray, colorless, lifeless, dull. You show this to a patient. I've actually asked someone, ask me, are those my toes? And I know that they were asking me in jest, but it's just because they couldn't see what we've spent so many years of our life perfecting and practicing on. But when you have something that's colored, well demarcated, itemized, depicted, it makes it a lot easier. And in this day and age, everyone's motivated by some sort of metric and gamifying the information, right? So if you're trying to get your patient really engaged, wouldn't it be great to say, well, you have 1.9 millimeters here on the distal of tooth. I hope that that's, let's pick a different one. Let's look at tooth number 19. So you identify those bone level measurements on tooth number 19. You say, our goal is for these to not progress very quickly. We want to keep them as close to 0.6 and 1.3 as possible. If in the fact that you get periodontal disease, at some point, these measurements will be higher. What a different conversation. We've all had the patient who sits in the chair and says, what are those numbers you're recording? What's the periodontal, excuse me? So this is another way to have this conversation, and they can see it versus the probe being in their mouth and you have to hold a mirror. This is the radiographic version of it. It really brings some light to some of the patient's eyes to be able to see it. And what it's actually doing is working on this triangle of trust, right? And triangle of trust comes from logic, authenticity, and empathy. And authenticity as a provider is saying that you're showing and telling in your authentic voice what their needs are. Empathy is sharing that you care about them and that their success is important to you. But the logic, right? We really want to make sure that they're with you on the logic so that we can build the final leg of trust. And helping them say, I know you can do it, by empowering them to understand the status of their oral health and giving them the reasoning, the logic, and the judgment as to why they have a certain diagnosis, why you're treatment planning it, right? Give them these core drivers and show them with color and quantification that the logic piece is not what's going to diminish their trust in the care that you're going to provide to them in any way. So when we're looking at this, we're looking at case acceptance increasing because now the patient has built that trust because you're showing and helping them understand at a greater level what you're going to provide and understand as a provider. then you're going to improve the operational efficiency and consistency across your entire organization, since everyone's seeing and able to access the documentation and seeing, and there's calibration amongst the findings that are on the radiographs. Ultimately, this leads to a better patient experience because everyone's speaking to the patient in a similar manner. Ultimately, it leads to satisfaction of the patient, better patient outcomes, and hopefully, ultimately, reducing that oral health disparity that exists. And I will take a couple minutes to get you guys excited about the future, because this is just the beginning of AI. AI is going to be interwoven into many parts of our lives. And specifically in dentistry, we've had so much unstructured data. I don't know if you guys work with any other clinicians. I will make a quick pass at dentists note-taking. I feel like we need a cipher of many different languages to be able to decipher notes, but it's considered unstructured data. Though we all provide similar care and are dealing with similar pathologies and doing similar treatments, the notes are very unstructured. The terminologies are different. So we need large language models to help structure this data, help understand what kind of care was given, what materials were used, and categorizing and identifying, because we know data input is very difficult to do. Similarly, radiographs. Radiographs are unstructured data because we don't know what is in the radiograph, because there's no way to systematically read them unless a human reads them. But a human doesn't input all of that data anywhere. So AI actually does all of this structuring of data. It understands where a whole tooth is. It understands where the findings are. It understands where the areas of potential decay are and other dental conditions, as well as in conjunction, we'll in the future be able to align that with the notes, looking at historical data, looking at biomarkers, looking at other modes of data that also exist within dentistry, because there's so much, whether it be demographics, dental medical histories, claims, treatment plans. There's a lot of data that leads to this precision and health that the patients can experience. And when you build these AI tools well and incorporate them into practice well and effectively and efficiently, the things that can be built are there to help detect, quantify, track disease progression in a new way. There's just nothing like it when you say, for example, Carrie's models are now going to be trained with 3D models in the back, and now we can start thinking about volumetric impact, right? Not possible before. Or looking to determine treatment plans and their outcomes based off of more information than just that one single exam that you have. Maybe you know something that's going to impact their care because of their medical history, but you've only ever seen so many patients that have cancer, right? So maybe that kind of cancer is new to you, and we can understand this patient outcome a little bit more closely because the AI is able to be there to support, as well as automating those administrative tasks, whether it be scheduling, whether it be filling out a claim, sending post-operative care. If the system understands, well, the patient has received an extraction, you've given post-operative note care instructions during the appointment, but sending up a follow-up and a reminder, like make sure that you're taking your medication and your prescriptions on time, making sure and sending the follow-ups for the follow-up exam. Things like this just will make things a lot smoother. And then hopefully, my hope is that we enable this transformative care model for us rather than just always treating and looking for disease, but we want to make sure that we're leading to ultimately better outcomes for our patient and all of the impact that we possibly can have. I'm seeing lots of questions come up. Is that correct? I think you're muted, Dr. Dolan.
Apologize for that. Yeah, thank you, Mina. Diane Brunson asked a really excellent question to the points that you were just making. What are the prospects of AI helping with medical dental integration? We still have issues with medical and dental charts not working together, and that's very true, Diane. And I'm concerned that we're developing another siloed application. So I think that's a fabulous question. I'll respond, and then Mina, you might want to add some comments as well. As Mina is illustrating in this chart, lots of the unstructured data might be health history, for example. We, of course, want to collect blood pressures, and we want to know a person's hemoglobin A1C, or we want to know if they're pre-diabetic or diabetic. And if we could collect those data and summarize them in a way, extract them from the patient's record in a systematic way, and then compare those to periodontal findings, for example, or the patient's treatment record related to routine cleanings or scaling and root planing, because we know that periodontal treatments can be very useful and effective in helping a patient maintain a healthy hemoglobin A1C. I think the opportunity to extract data in a systematic way and in structured format, and then create analytics or reports that enable either the individual clinician or the person might be supervising a group of clinicians or managing care delivery within a system of clinics. I think that that's really the power of big data and the opportunity to use data in a powerful way that, in ways that we know there's all the evidence base that supports, say, this relationship between periodontal disease and diabetes as just one example. Let's use the data about the patient in the record to help us monitor and manage care more effectively to get better outcomes. Amina, maybe you want to add to those points.
Oh, absolutely. And with that, I think it's important as clinicians to understand that these tools exist, right? If we don't understand the power and the impact that AI can have, industry is going to create these models without the clinical knowledge to find them. So having the communication, giving feedback, are the models working? What do you expect back from these models? And that's where innovation is, right? The need, and the progress together. So actually, with that, do we want to lean into, I think my next slide is questions, commentary, things to that effect. So I saw you typing away furiously.
I did respond to a couple, and maybe before we get to the formal Q&A, there was a really good question about staging and grading and periodontal
Oh, I
assessment.
can go back.
And I thought maybe we want to spend a minute talking about, this particular software, similar ones on the market, do a nice job measuring interproximal alveolar bone level measurements. But we know that it takes more data than that to stage and grade. So maybe you could comment on that relationship.
Absolutely. So I brought up this specific image because it has teeth that have elevated bone levels, right? And after speaking to many periodontists, they say, well, CEJ to crestal bone is not a metric for staging and grading, right? We know that there's biologic width. We need to understand the status of the gingival tissues, the gingival margins, all of that. And additionally, there are other factors that go into staging and grading. What this does do is help support the radiographic bone loss segment of staging and grading. The other portions are part of the patient interview and the clinical findings that you obtain, whether it be from the charting, the periodontal charting, which we do pull pocket depths from the electronic health record. So that's, once again, bringing in multiple types of data into one space so that it can be reviewed more seamlessly. But what I want to identify here is that just pocket depths, it doesn't necessarily mean that there's recession and bone loss, right? We need to understand the complete picture, and a radiograph just doesn't give that today, right? You need to have way more to make a complete stage and grade.
And so I would say the platforms available today are really, they pull elements of the data, but none of them, for example, although we're currently working on this, would integrate photos, for example, that would have an indicator of levels of inflammation, which would get us closer to staging and grading. Or some might suggest that maybe the staging and grading approach might need to be modified a little bit or AI enabled in a way that makes the process a little more efficient for clinicians who are really working hard to accurately assess periodontal status and treatment needs. And maybe the current process is not that efficient or as easy as it could be. I'd also use this opportunity to make the point that when we talk about overdiagnosis or underdiagnosis or overtreatment and undertreatment, it's very interesting to me as we review, hundreds, thousands of images that flow through our platform, that it's probably no surprise to everyone that periodontal conditions in general are much more likely to be under-recognized and undertreated. And I would say that that's a really important opportunity in all clinical settings, and especially public health settings, that periodontal conditions get accurately assessed, documented, and treated. And that's important not just for the oral health, but of course, overall health and well-being. Mina, I guess there was one other question, and before we can maybe open it up, about the software integration and maybe just a high level summary. Like you have AI and machine learning models that do detection of clinical findings like, decalcification, demineralization, caries, alveolar bone levels. But how are those integrated to, say, a practice management system or an imaging system, and why is that important?
All right. I only brought this slide up just to highlight like AI happens in silos because they're different models that are developed and designed. So this is just to keep that idea and picture of different models do different things, right? So I'm going to switch off of that for a second. When discussing 2D radiography and this enablement of broader applications of AI and the things to look forward to in the future, get my practice management system integration here. So when you're talking about 2D radiography and the information that might be in the chart, you have two systems. You have the imaging system, whether it be a PAC system, you're using whichever of the imaging systems that you're using that might be in conjunction with or without your electronic health record or practice management system. We need both pieces of data to be able to unlock what you're seeing here on the right-hand side of the screen. You can always annotate the images in this early stage with predictions and findings. However, you can't unlock demographics, medical history, dental history, treatment plans, treatments completed, and things like that without integrating the information from the electronic health record. That enablement comes from having the data from the practice management system. Now, depending on which companies you're looking at or which products you're looking at, these may vary.
Yeah, and I would say as you explore different products and, and in this journey and exploration, that would be some of the questions you would ask, as well as the actual, say, FDA clearances. This considered software as a medical device, I think, as Mina mentioned previously. And so they do have to be cleared by the FDA. And so as you explored, different products on the market, those would be some key questions to ask, for which FDA clearances do you have and for which clinical application. So, Danae, we probably used up a lot of the time, but is there anything we missed or any other questions that you'd like to highlight?
One more question. What can be an approximate cost for obtaining such software?
So if that's a great question. I think some of it depends, since FQHCs really vary in size and patient volume and image volume. I think it would be more appropriate to maybe explore each individual company, or in this particular case, if you wanted to move into that exploration, there's a QR code here that you could use for that purpose, and or look for us at the NO exhibit at the annual meeting. I would say in the private practice setting, depending on the product, it could be anywhere from a subscription of $250 to $500 per month per clinic. But I would say that those costs probably don't reflect the size and and some of the clinic. If some FQHCs I know are much larger or have multiple clinics, and so I don't know that that would be a fair estimate for all FQHC clinics or all community health centers.
Thank you, Dr. Dolan. But I would like to thank our speakers, Dr. Dolan and Dr. Carboni, for this informative presentation. You may email any questions related to the webinar to our NOAA staff at our email and call us at our Denver office. I did put the information in our chat box, including the PDF slides. Remember, the survey will be automatically be emailed from Zoom to all attendees who attended and viewed the webinar for at least 75% of the time. If you're requesting CEs, we can only issue those CEs for those who submitted a survey. So within 10 business days, you'll receive a link from NOAA to our Learning Hub where you can download your CE. The deadline to submit a survey will be Monday, August 19th, end of business day. If you do not receive the survey, please contact NOAA. I did put everything in the chat box within 1 week of the webinar so we can assist you. But that concludes today's webinar, and I hope everyone enjoys the rest of your day. Thank you so much.